hi there, folks. Welcome to the program. This, of course, is Stinchfield The Podcast. I want to talk about what I think amounts to a CDC admission. They changed the guidelines now for isolation. Heck, you don't need to stay home for 5 days anymore. Now, 24 hours after being fever-free, you can go out in the public and do whatever you want. Lo and behold, this is exact same guidelines for the flu and a common cold and everything else. The CDC also, there's now contemplation to change the VAERS system name. This is the Vaccine Adverse Event Reporting System, to a new name. What is this about? And what is Bill Gates' involvement in all of this? The state of SARS-CoV-2. My guest is Dr. Peter McCullough today. I don't know if there's anybody who's more of an expert on this stuff than him. I can't wait to break it all down with him. So with that, let's get the show started. Don't forget, though, folks, twc.health/Grant. They're the sponsor of this program, and I'm so honored to be involved with them. twc.health/Grant. Get all the medication to protect yourself from all the things we're talking about today. Have that kit on hand. Use promo code GRANT for 10% off. All right, folks, here we go.
Uncensored and unapologetic. This is Stinchfield. Here's your host, Grant Stinchfield.
All right, as promised, I told you my friend Dr. Peter McCullough would be with us. Dr. McCullough, it's great to see you again.
Thank you.
So many things to talk about here. I think I want to start with what I think amounts to an admission. Why all of a sudden now are we changing isolation from 5 days to the typical 24 hours after being fever-free? What's going on here?
The CDC is backpedaled progressively. You probably remember people being in quarantine for 2 weeks. All of that was a giant overreach. It was an assumption that the virus was much different than really what we knew it was to begin with. It's a beta coronavirus. There were 4 of these that caused the common cold that was known for by decades. This one was modified in the Wuhan Institute of Virology, but it didn't mandate or call for anything what we would have done for the common cold. And that is, once we're fever-free and symptoms are controllable, we return to normal activities. Patients test positive, Grant, for months afterwards. We cannot rely on a PCR test. We have to rely on clinical symptomatology.
So this is interesting, Doc, because I went back and looked at some of the data for hospitalizations during the COVID pandemic. And I go back to 2022, January of 2022, they said they had about 3,000 hospitalizations per 7 days. This is CDC data. Then lo and behold, all of a sudden, April, which is not that far later, of 2022, it plummets to 200. I think something happened there. I think that something happened with the testing. Something was not legit. What was happening with those numbers that would see such a dramatic drop in just a few months?
It's just a change in testing practices. What we've learned is that the only people who need a test are people who are acutely symptomatic with suspected COVID pneumonia, not to test people with orthopedic problems or coming in for elective surgeries and procedures. Hospitals over-tested. That inflated the case count. It detained patients, separated from their families, and it was all wrong policy.
All right, so this is going way back now when we had, case numbers that were, just thousands upon thousands of them. I now believe that the flu was getting lumped in with this. We had basically 0 cases of flu. Do you think that's the case?
The original CDC created PCR tests that the laboratories adopted, including ours, by the way, in Texas, the laboratory-derived assays, they could not distinguish between influenza and the flu. So when people came in, particularly elderly people, if they were just tested for COVID, they would be positive, and indeed they actually had the flu. So we'd actually have to test for flu and COVID, then realize that COVID was false positive. That wasn't done. So my hunch is, like yours, is that particularly our senior citizens with influenza were mislabeled as COVID. And Grant, that means they were isolated, separated, and they weren't treated for influenza. They were treated for the wrong illness.
And people died because of that.
They did. And, even to make matters worse, in New York State, they were returning sick people back to the nursing homes. And now Andrew Cuomo is being called to Congress He's being called up. We predicted this in our book, Courage to Face COVID-19. He's not going to get away with this. This was terrible policy. Our seniors were mistreated. And boy, you're right. Some of them died, sadly, for no reason.
When you think about all of the lockdowns, all the mandates, all of the life-changing things we were put through from what I dub now a tyrannical government, and I don't like to throw tyranny around easily. I think conservatives sometimes throw that term around too easily, but this was tyrannical what we went through. No one talks about this idea that flu cases were lumped in there, and I think the CDC's own website shows that there were like virtually 0 cases of flu. That's impossible.
It's true. Influenza is always there. It accounts for about 15% of all upper respiratory tract infection hospitalizations through the winter. A paper from CDC 1040 showed that again last year. So we know that's consistent. It just can't go to 0 in a year. The influenza vaccine, poorly effective. We treat it early. We've got, I think 3 drugs, including 1 IV drug we could treat early. Influenza, the reason why people can die with influenza is they get a secondary staph pneumonia. So we have to treat with antibiotics in the hospital. But influenza, again, just like COVID, treatable early has to be detected, and we have to move quickly. The point is, all of this should be shifted to the outpatient world, not the hospital.
All right. And so here we have now, at one point, COVID at the height was the 3rd most prolific killer of Americans. Now they say it's down to 10th on the list, and so now they've moved this mandatory isolation from 5 days to 24 hours. Do you think all of this amounts to some kind of an admission, even maybe quietly by CDC? Are they backtracking? Do they admit they got it wrong?
It's a quiet admission because remember, anything they're recommending now should have been the recommendations back in 2020. It's the same virus. Now, it's mutated, it's milder, and we have a lot more natural immunity now. But, fundamentals of early treatment are the same. The vaccines are the same. They basically didn't work. In-hospital treatment is the same. It's been poorly effective. So what else can it be, Grant? It must be an admission that they were wrong to begin with.
I believe, and I've talked about this, when socialists and communists want to take over a country, they slowly push all of these things on us as tests. Early on, Dr. McCullough, I said, I think the COVID lockdowns and mandates were a test to see how far they could push us. I've changed my thoughts on this. I've gone back and I've watched former KGB agents talk about the Soviets wanting to take over America, and they had a 20-year plan. Well, this goes back 70 years ago. This 20-year plan that they had to take over America goes back a very, very long way. I actually think that the COVID mandates, all of what we went through, the tyrannical push by government, was the culmination of this move. And the end result was they underestimated the American people. The reason it didn't take 20 years to get us into a socialist communist government is because the American people stood up and said, no. Now, I know we're moving closer to that, but you know what? The American people are so resilient. They tried to normalize the mandates, and normalization is the last effect of trying to push you into this dictatorship-style government. It's normal to have mandates. It's normal to be told what to do. Normal to take what vaccine the government tells you. Doc, I don't think it worked. And in many respects, I don't think it worked because of people like you and others that are out there speaking. I think the American people were onto this. We're not going to let it happen.
At least in terms of the vaccine, Grant, about a quarter of people understood the vaccines weren't safe. They didn't like the idea of mandates. And, thank goodness for people like you and the independent media. You have the megaphone to get, news out. This has transcended 2 presidential administrations. Now we have the same 2 people facing off again. There must be a tremendous deep state. We certainly know in my book, the biopharmaceutical complex, that involves the FDA, the CDC, the NIH, but also the Gates Foundation, Rockefeller Foundation, Wellcome Trust, Gavi, WHO, UN. I mean, they are deeply coordinated. We know this because if you look at who goes to Davos, that's kind of the invite list and the people who we believe they think they want to actually run the world through this new world order.
Doc, what I want people at home to know is I've known you now for a while. This talk about deep state and a biopharmaceutical complex and all of these things. This is very new to you. You were not talking about this in 2018 or 2019, were you?
No, I wasn't. I was, in 2019, I was endowed, named lecturer at Harvard. I lectured at two major divisions, professor of medicine, lectured all over the world. I had no idea that behind the curtains was this growing ideology, this kind of medical tyranny. And that if we didn't fall into line, that, there was going to be extraordinary consequences. And boy, were we woken up. I didn't see this coming at all.
Yeah. All right. I want to quickly talk about the wellness company and just let everybody know that they can get this emergency kit. And now there's 4 of them, I believe, Dr. McCullough, for just about anything. If you're traveling, there's a certain kit with prescription medications, all to help you deal with illnesses you may get while you're on the road. The medical emergency kit for your home, the antivirals, the antiparasitics, ivermectin in there, which is still so hard to get in many respects. Here's what people can do. Go to twc.health/grant, twc.health/grant. Use promo code GRANT for 10% off, and I promise you will not be disappointed. I have used these kits on numerous occasions for both myself and my son, and it's been a godsend because of the speed that I can get this medication into my system. And Dr. McCullough, the speed is what's so important here, isn't it?
It's true. In infectious diseases, it's time to first antimicrobial administration. So you can imagine somebody with a bladder infection. Women know when they have a bladder infection, if they can treat like nearly instantaneously, it can be snuffed out within a few doses as opposed to being days into it. Same thing with a bronchitis, fungal infection. How about, getting cut and starting to get a skin infection? Yeah. Well, by 3 or 4 days, it can be really severe. You get it right away with that first dose. People can treat themselves. There's good backup with the telemedicine service. I think the kits really are a must-have.
Yeah, I do too. twc.health/grant. Use promo code GRANT for 10% off. I promise you won't regret it. Look, we just saw the pharmacies close down with that that computer hack. This is the exact reason why we've been preaching to get this. All right, Dr. McCullough, I also want to ask you, you mentioned the World Health Organization. I found, and then I want to talk about Bill Gates as well. They're all kind of intertwined here with this push for the vaccine. The leader of the World Health Organization is now calling this post-pandemic period an infodemic. And the infodemic is, quote, according to the World Health Organization, the fast spread of misinformation. And I promise you, Dr. McCullough, you and me and the Gateway Pundit and Breitbart and Real America's Voice, we're all on the top of the list of the purveyors of this, quote, misinformation. But how arrogant. They call this an infodemic when really all we're doing is pushing out, one, truth, questions, and demands for answers. Correct?
Actually, that's very well stated, Grant. All we're doing is simply providing the data in a dispassionate way so we can have an intelligent conversation. I cite all the studies. There's no such thing as misinformation or disinformation or malinformation. It doesn't exist in medicine, doesn't exist in my world. But by the way, papers in the peer-reviewed literature using those terms didn't appear until 2021, Grant. This is basically propaganda. The WHO is in the business of propaganda. They need to be focusing on, world famine or other issues, not be focusing on what we're doing in the peer-reviewed literature. That's kind of the domain of academics, scientists, and doctors.
It seems to me that their claim is that all of us are not smart enough to interpret the information and data, so we need to rely on them to do it. I think what's really at play is they're afraid of us interpreting the data that may come up with a different conclusion of them.
Well, that's the thing is, really, they're afraid of anyone who disagrees with their presumptions. So they presume they're correct on everything. Therefore, if you don't agree, then you actually are someone who can be relegated to someone who holds misinformation or disinformation or malinformation. That's actually propaganda. The other terms that are used are anti-science, anti-vaxxer, and conspiracy theorists. Those are actually all propaganda terms. Those are people who are trying to exert power over another person.
All right. So the medical journal JAMA, JAMA, now had, I guess it amounts to an editorial, somehow loosely tied to Bill Gates. And the woman writing the editorial is calling for the vaccine adverse event reporting system to have its name changed to the Vaccine Safety Sentinel. Again, I think they're arrogant because they're claiming that we cannot interpret all the data that's being pushed up onto the VAERS system. How dare they tell us we can't interpret it? Doc, I have full faith that you can interpret it, and I have full faith that if I have questions, I might call a guy like you.
Grant, the VAERS system is very accurate. It's been used for 30 years. There's hundreds of peer-reviewed manuscripts that rely on the data. I make VAERS entries virtually every day. I made one just a few hours ago. Doctors enter data on patients who suffered from vaccine injuries into VAERS. We do this. So do nurses and paramedics. We wouldn't enter it if we thought the vaccine didn't cause it. So it's strongly causally related to the vaccines, the data that we present. And now this Dr. Jameson, who's at the Annenberg Institute, the Annenberg Institute is funded by Gates Foundation. Now she's undermining VAERS, saying the name should be rechanged to actually try to tone down this giant safety signal we're seeing in VAERS with the COVID-19 vaccine campaign.
All right, let me just read to you from her her editorial here. How can we improve the public's understanding of vaccine surveillance reports and their significance or lack thereof? A simple first step might be to change the name of this system from the Vaccine Adverse Event Reporting System to one that more accurately describes its purpose. For example, in our opinion, reterming the system Vaccine Safety Sentinel would remind audiences that the incidents of concern are unverified, related to safety, and part of a monitoring or early warning system. Adding safety to the title would align the system with others in the CDC vSafe. Notable among them that include safe or safety in their name. Adding Sentinel would align the system with the FDA's Sentinel initiative. Either Watch or Sentinel telegraphs that this is an early warning system, not a catalog of confirmed cases. With that, Dr. McCullough, what do you make of her assessment there?
Grant, when I enter a case, the CDC has the patient's name, address, phone number, email, vaccine information. It's up to the CDC to verify it. That's not up to you and me. The CDC should be verifying these events, and they're classified as adverse events or serious adverse events. We check the box for hospitalization, death, life-threatening illness, which makes them serious. This idea of safety sentinel, all that's going to do is confuse Americans. This is an adverse event reporting system. It's a hard, factual system. And what Gates and the Annenberg Foundation, Dr. Jameson, are trying to do is they're trying to take the eye off these vaccine injuries, disabilities, and deaths.
Yeah. So you look at the vaccine adverse reporting system and whether or not the CDC confirms these accounts. I've read numerous articles where doctors have said, no one ever called me. No one ever called my patient. No one ever got in touch with them. Or is the CDC even really investigating these adverse reactions?
They should. In fact, an audit of VAERS should be done to see if the CDC is contacting the patients, getting the additional information. They need to get the hospital information, confirm this. The CDC has a lot of work to do. They have 18,500 deaths. They have to contact the family members. I have a feeling, Grant, the CDC has done little or nothing during this entire safety debacle, and now they're way behind on doing their verification work.
For a long time, I've been with Ron Paul on audit the Fed. Now, maybe the new mantra needs to be audit the CDC.
Yeah.
All right. So looking at this, you mentioned Bill Gates, the Gates Foundation. Boy, he's got his hands in everything related to the vaccine. What is really at play there? Why is Bill Gates so concerned about this? Or should I say, why does he pretend to be so concerned about this?
He's completely subscribed to vaccine ideology, but with a goal. Remember, years ago, he said he could earn 20-to-1 return on a vaccine compared to anything else he did. He knows that vaccines are rich, they're lucrative, And Gates is a top donor to the World Health Organization, to the CEPI, the Coalition for Epidemic Preparedness Innovation, a vaccine incubator, to the CDC Foundation. And now Gates Foundation has a memorandum of understanding with the FDA. So you're on the right track. The Gates Foundation is way too involved in our public health, and I think basically represents a threat to having an egalitarian approach to solving the world's problems.
What is the motive of Bill Gates and his foundation? I don't believe it's the safety and security of the people of the world. I think it could be money and power.
I agree. I think it's entrepreneurial in spirit. He never dropped his entrepreneurial nature when he went through everything he did with Microsoft. He basically became an entrepreneur with the foundation, and vaccines are his target investment portfolio.
All right. One more time, I want to tell people about twc.health/grant. This is a great website, one, with doctors who are critical thinkers, like Dr. McCullough and others, Dr. Thorpe, and so many others who come on this program. I urge people to go check the website out. The medical emergency kits are fabulous, but peruse the website because there's so much more than that. You got the spike support. Doc, the spike support is critical for anybody that, I used to say anybody that has already taken the vaccine, but the spike support really is critical for anybody, isn't it?
It is. People have had COVID at least once, multiple infections. Think about spike support, 3, 6, 9, 12 months. It's going to be needed. You know, the Japanese take the principal component nattokinase. They take it basically indefinitely for its cardiovascular benefits. So spike support, very healthy for the cardiovascular system.
All right. Again, folks, the website is twc.health/grant. Use the promo code GRANT for 10% off. I promise you won't regret it. This is about keeping your family safe. I've got ammunition. I've got food. I've got things that can filter my water. My friends might call me crazy. Some say they'll be at my house the moment something happens, right? Those are the smart ones. Get prescription medications on hand as well. These kits can really help you. All right, Doc, before I let you go, I saw this on one of your emails, and I urge everyone to subscribe to your Substack too, because every morning I get your emails, every morning I read them, and I'm fascinated by the work that you're doing. And quite frankly, I don't know how you do it all. But you had this definition of the vaccine has changed. Mm-hmm. What is going on here? What's changed?
The definition changed from a vaccine actually preventing a disease. That's the reason why you take a vaccine, now to being a really soft definition, saying, well, it creates immunity to something, meaning it may not stop the disease at all, it may not do anything. This was a way for government agencies to be able to say that the failed COVID vaccines are still vaccines despite failing, stopping COVID or stopping hospitals and deaths. So basically, it's a giant cop-out.
You know, I get people emailing me all the time. I talk about this topic a lot on Real America's Voice, on the podcast with the wellness company here, and I mean, all the time. And they tell me, stop calling it a vaccine.
Right.
Are they correct when they yell at me about this?
Yeah, it's not a traditional antigen, live attenuated, or killed vaccine. You know, recent book I summarized on my Substack by Dr. Karina Acevedo Whitehouse, she calls them vax genes. They're really genetic transfer technology products, not traditional vaccines. I use the word vaccines so that's how the person knows about it. They can understand, you know, what we're talking about. But you're right, they're not truly vaccines.
All right. I'm going to put this up. I pulled this from one of your emails. This is how the CDC definitions changed. Before September 1st, 2021, a product that stimulates a person's immune system to produce immunity to a specific disease, protecting the person from that disease. Vaccines are usually administered through needle injections. Goes, okay, blah, blah, blah. After September 1st, 2021, a vaccine, not a product, but a preparation that is used to stimulate the body's immune response against diseases. And then it goes on to say the same thing. Subtle difference, but important, Doc.
It's true. Not only that, but the second definition, basically, it doesn't say the vaccines have to work. It means even a failed product could still be used. This is, in a sense, a cop-out. By September 1, 2021, they knew the vaccines were failing Grant.
You know,
And so
I've
they
got
had
this
to change the definition.
on the screen. Vaccination, the act of introducing a vaccine into the body to produce immunity to a specific disease. That's before September 21st.
Yeah.
Vaccination, after the change, the act of introducing a vaccine into the body to produce protection from a specific disease. One was to produce immunity, the other to produce protection. I'd rather have immunity, quite frankly.
Yeah, immunity means you don't get it. Protection means kind of like a leaky umbrella. You're still going to get wet, but you're still going to get it. It's basically a way of softening the definition. And it was so obvious to people who were paying attention that they were telling us they know the vaccines don't work.
Yeah. We've been saying they don't work because a vaccine is supposed to produce immunity, as you said. They don't do that whatsoever. So literally, instead of admitting they don't work, they just change the definition to show that, oh, yeah, they work. They meet the definition of to produce protection. Last question for you. I've got family members that are so on board with this vaccine. I don't know, they're on like the 52nd vaccination. And they say, well, you know, we got sick from COVID and they were down for a week, 2 weeks from COVID, hit hard, even though they're boosted 62 ways to Sunday. Does the vaccination reduce the severity of COVID? That's what they're pushing on people now.
No, the vaccines never reduce the risk of hospitalization or death or severity. Now, there are some things that do. One is early treatment clearly reduces a severity of illness. The virus mutating to a milder form, that actually reduces severity. And then very importantly, natural immunity. Yeah. When you have already had it once or twice, the body's own natural immune system. So you can get it multiple times, but it's early treatment. The virus mutating to a milder form than natural immunity, which has basically made it so mild now that we don't even worry about it. Most of the time, we don't even test for it. It's like a common cold.
Well, just to review as I let you go, I think the takeaways are that people are going to survive this this virus, especially if you get early treatment. The McCullough protocol is great. The twc.health/grant, the wellness kits on that, the emergency medical kits on there can help you get early treatment right away. But I think when you look at the WHO claiming we're in an infodemic, that is arrogant, that they don't want the spread of truth getting out there. You look at the isolation period being decreased now from 5 days to 24 hours after fever for a normal. And then you look at changing of the vaccine, the definition. This sums up what's happening here right before our eyes. To me, it's a massive cover-up. And thank you so much, Dr. McCullough, for shedding light on that cover-up and really pulling back the blankets and shedding light on it.
Thank you.
Absolutely. All right, folks, just a quick reminder, of course, twc.health/grant. Use promo code GRANT for 10% off. There is the telehealth option, and I mean it when I tell you. Dr. McCullough and the other doctors involved with the wellness company are critical thinkers. They do not just regurgitate what the FDA and the CDC and the NIH tell them and the World Health Organization tell them to say. This is what you need in a doctor. Critical thinkers who can make decisions what's best for the patient, not what's best for government or big pharma. twc.health/grant, the emergency medical kits. You have to have one of these on hand. Get them now. twc.health/grant. That is going to do it for us, folks. Stinchfield's Army rolls. Thanks to all of you. We will see you on the Real America's Voice show, of course. And I appreciate you watching, and thanks to the Wellness Company as well. See you, folks.